Yield myself such time as I may
The gentleman from New Jersey is recognized.
I rise this morning to speak in favor of the House amendment to S-524. Over the last 2 days of floor debate, we've heard heartfelt speeches from members of Congress about how the opioid epidemic is affecting their constituents and, for some, their own families. We've heard from both Democrats and Republicans, members from urban districts, suburban districts, and rural districts, as well as members from every region of the United States. Is that no community has been immune to this crisis, including communities in my home state of New Jersey. About 256,000 New Jersey residents are addicted to heroin and prescription opioids. That's nearly the same as the entire population of Newark, the largest city in New Jersey. So this is a serious crisis that demands an urgent response. A comprehensive solution to the crisis will require real dollars and must take an approach that targets the full spectrum of addiction, that is prevention, crisis response, expanding access to treatment, and providing support for lifelong recovery. The approach must be guided by science and cannot be deterred because of stigma or misperceptions about proven treatment and intervention strategies. And I'm pleased to support the package of opioid legislation that we're considering today because it takes steps towards that approach. This bill incorporates proven public health approaches to fight against the heroin and prescription drug abuse crisis. It improves the tools available to prescribers to prevent opioid abuse and the development of opioid use disorder. It expands access to life-saving naloxone, an opioid overdose reversal drug, to respond to those in an acute opioid crisis. It expands access to evidence-based treatments that help individuals with opioid use disorders enter recovery. However, Mr. Speaker, I want to make clear we must go further to ensure that the scale of our response is proportionate to the burden of the crisis. We not only need to support individuals' entry into recovery, we need to ensure that we provide access to the supports and services that lead to lifelong recovery. And we must also further expand access to BUP, or buprenorphine, and office-based medication-assisted treatment for opioid use disorders. Currently, we do not have adequate treatment capacity to respond to the unprecedented demand for opioid use disorder treatment. And that's why we need to expand upon the Opioid Use Disorder Treatment Expansion and Modernization Act to significantly increase the number of a physician can treat with this medication, as well as permanently allowing nurse practitioners and physician assistants to treat patients with this medication. In the committee, Democrats voted to raise the cap to 500 patients for qualifying physicians with appropriate credentials. Additionally, committee Democrats and Republicans voted unanimously to permanently allow nurse practitioners and physician assistants to treat patients with BUP. I'm committed to continuing to work with my colleagues as part of our conference with the Senate to ensure that we lift the arbitrary and harmful physician treatment cap and to ensure that nurse practitioners and physician assistants in every community can permanently use their skills and experience to serve those in need of opioid use disorder treatments in their community. And finally, Mr. Speaker, I want to be clear that we should not be under the illusion that we can adequately respond to this crisis without providing urgently needed resources. And waiting on the appropriation process isn't suitable. Our states and communities urgently need money now. Additionally, we should not be forced to cut other discretionary funded public health programs to provide resources for substance abuse programs. The discretionary funding caps have already left many of our vital public health programs underfunded, forcing additional cuts to those programs in order to provide funding to respond to the opioid epidemic. And it will limit our ability to adequately respond to the opioid crisis, as well as to meet the remaining public health needs of our communities. We don't have to guess how it turns out if we fail to provide the urgent, robust funding that is desperately needed. And sadly, the evidence is already staring us in the face. It'll be more lives lost to the epidemic. It will be thousands more Americans who will continue to be left behind to battle without treatment and recovery support services they need. So we're losing now, we estimate, 78 Americans each day, and we can't afford anything less than a comprehensive, well-funded federal response. So I urge my colleagues to vote yes to this legislation because I believe it takes important turning the tide in this crisis that is taking the lives of 78 Americans every day. But I also urge my colleagues to support providing the financial resources and additional tools necessary to meet the burden of this crisis. And with that,